Hey everyone, I am here with my friend Ray Dorsey, MD, because he has a new book out. He was on the podcast some months ago, and it was one of our very best performing podcasts because Ray is not just a great scientist and a great physician, he's a great communicator. And now he has a new book with his colleague Michael Okun, and I need to meet Michael someday. I haven't met him yet, I think. It's called The Parkinson's Plan, a new path to prevention and treatment. I'll hold it up too on the screen. There is brother Ray. Welcome. I'm so glad to have a chance to talk to you. We're going to link to the podcast where we had a long conversation, but I was really struck by your continuing focus on both ends of the continuum when it comes to Parkinson's. One, the individual personal care level, and as a physician treating Parkinson's patients, obviously that is very close to your heart, but you also look not just at the environmental issues that define the disease in so many ways, but you also look at the importance of policy change. So I just want to start at the question I formulated in my mind is, so someone receives a diagnosis of Parkinson's and they come into your office, they've just been diagnosed, and maybe it's not very advanced because it hasn't been diagnosed until fairly recently. What are the steps? What's the Parkinson's plan for that person who walks into your practice room?
So it used to be, first of all, it's a delight to be with you. Ken Cook and the Environmental Working Group are transforming the health of our environment and the health of all of us. And they've been doing so for years. And I'm delighted to be on this journey with you. So it used to be when you got diagnosed with a disease like Parkinson's, you got immediately told about medications. In the book, we outline a plan for Parkinson's disease to prevent the disease, learn why it begins, and amplify the voices of those affected by the disease and navigate the new frontiers of disease. I've actually changed my approach in part because of you and others. I spend a lot of time trying to figure out why they got the disease. And just in general, if you don't know, if you figure out why you got a disease, one, you can perhaps treat it better. Two, perhaps slow it down. And three, most powerfully, develop a cure for the disease. You can't cure a disease if you don't know its cause. I can't really think of any medical condition that we cure medically without knowing its cause. And then once I know why they have it, like was it pesticides in their well water? Are they working with pesticides now? Are they being exposed to dry cleaning chemicals? I then tell them to stop that exposure. So if a smoker gets diagnosed with lung cancer, what's the first thing that doctor tells them to do? Stop smoking. But if a farmer gets diagnosed with Parkinson's disease, are we telling them to be concerned about what pesticides they're spraying on their fields? So people with Parkinson's disease have different rates of progression. Some go fast, some go slow, and we don't know why. But I think one of the reasons is some people might still be being exposed to the chemicals that are fueling their Parkinson's disease, and some have long since stopped that exposure. So I spend time figuring out why they have it, and then two, cautioning and advising. And in the book, we give you the Parkinson's 25 things that might slow the rate of progression if you're among the million plus Americans with the disease, and 25 things to prevent the disease if you're among the 330 million Americans without it. That's the first thing. Second thing is I talk about the importance of exercise. Michael Okun really highlights that in the book. Vigorous exercise can not only reduce your risk of getting Parkinson's, but it's really beneficial enough to make you sweat. I tell people at least an hour a day. And if I had Parkinson's, I would do 2 hours a day. And then we get to medicines, but only after first learning why, advising them things that they can do in their everyday environments to possibly slow the rate of progression, exercise, and then we get to medication.
So to me, that makes all the sense in the world. And I've been fortunate over the years to have medical practices and access to care where physicians had the time to have those kinds of conversations. Give me your sense of, not just in your case, because I think you've you've insisted wherever you practice medicine that you have that time built in because that's how you practice medicine. But but
Yeah, I mean,
that must be a challenge, right? How does a internal medicine doctor who encounters a Parkinson's patient for the first time and maybe refers them to a specialist, how do you find the time when health insurance and everything else puts so much pressure on physicians these days to crank through those patients?
yeah, I think the industrial model of medicine is not working. The industrial model seeks to maximize efficiency, which is fine, but is efficiency the greatest good? I don't think so. And then it seeks to minimize the amount of time that the doctor spends with the patient. They do offload as many things to others, and the aim of reducing the amount of time that the doctor spends with patients, so the doctor can see more patients. I've
Yeah.
had the good fortune of working for an organization that's focused on moving from reactive sick care to proactive preventive care. It's the Atria Health and Research Institute, and it cares for generally wealthy individuals and seeks to maximize the amount of time that its members spend with physicians. So I'm working in a different environment. But I do that in other ways too. Even I see patients for the last 10 years in a clinic run by nurse practitioners in Newark, Delaware, and I spend time with them. Um, but fundamentally, we're just not well positioned to address the rise of Parkinson's disease. Michael Okun points out we only train 40 or 50 Parkinson's specialists a year. And,
Wow.
today, 250 Americans are diagnosed with the disease. And so we need to, in the words of Ken Cook, move upstream. We need to figure out why these bodies are coming downstream to us. Someone needs to spend time to go figure out why people are getting sick. Why are people falling into the river? Why are people getting Parkinson's? Why are kids getting autism? Why are older adults getting Alzheimer's disease? Why are people getting ALS? And so our book is really, my passion, as you know, is figure out why so we can prevent it. For 99% of human history, for 199,800 years, there was a world largely free of Parkinson's disease. It's only in 1817 that Dr. Parkinson first writes the major description of Parkinson's disease. And it's only in the last 200 years that we've really seen that's be a major clinical entity. I think that chemicals in our food, water, and air are fueling the rise of this disease. If we address these chemicals in our food, water, and air, as the Environmental Working Group has been doing for years, we create a world without Parkinson's disease.
Well, and that's a life's work for a lot of us, and I'm just beyond proud to be working shoulder to shoulder with you on these environmental issues. One of the things that has occurred to me with the current discussion focused so much, in part because of HHS Secretary Kennedy on chronic disease, is how do we think through the the balance between what a physician can do for his or her patient and the obligation of the patient then to follow through and do these things, right? If it's obesity, if it's diabetes, if it's heart disease, chronic diseases seem to require chronic action, long-term action, new habits. How do you instill I guess, a discipline or a habit formation in your patients, Ray, so that when you tell them they need to exercise, they really embrace it. When you tell them they need to, eat healthier and spend time, with mindfulness and some of the other steps that are so important in your overall plan, how do you get those habits adopted?
So I really don't think the fault lies with the individual. Every society creates its own diseases. Every society creates its own diseases. For Parkinson's disease, the individuals didn't choose to get exposed to pesticides that are linked to Parkinson's
Right,
disease.
for
They
sure.
just didn't know. They didn't choose to they may have chose to live in an apartment above a dry cleaner, but they didn't know that the dry cleaning chemicals, some of them are known to cause cancer, some likely cause cancer, and they're linked to
Yeah.
Parkinson's disease. They didn't know that drinking well water was prone to be contaminated by pesticides not regulated by the Safe Drinking Water Act. More generally, who puts soda in kids' schools? We talk about obesity and who put soda in kids' schools. It's you and me, right?
Yeah,
That put the soda in kids' schools. Who's spraying pesticides on kids' playgrounds? Who's putting nerve toxins on it? And we ask why 1 in 31 children have autism. I mean, these are failures of us. These are failures of our society. They're not failures of
for
patients. The
sure.
patients are the victims. And, we had HIV in New York City and they blamed the victim. I mean, if we got to stop blaming the victim. We got to stop blaming children, people with Parkinson's disease, people with Alzheimer's disease, linked to air pollution. They didn't choose this. They didn't know this. Um, the, these decisions are made at societal levels. They're made by adults. And the seeds of Parkinson's disease, the seeds of autism, the seeds of Alzheimer's disease are planted at a young age, and they're planted in children. We talk about in our book, Brian Grant was a 3-year-old boy, when his father, a young man, was a Marine at Camp Lejeune, and he drinks the water that's contaminated with trichloroethylene, this dry cleaning chemical that's linked to Parkinson's, that's known to cause cancer. And 33 years later, he develops Parkinson's disease. His father would have been part of a cohort that was studied by Drs. Caroline Tanner and Sam Goldman at UCSF, and they found that young men aged 20 served at this contaminated base 34 years later had a 70% increased risk of developing Parkinson's disease. The Marines didn't choose this exposure. Brian Grant didn't choose this exposure. People who grew up on farms did not choose this exposure. These are decisions that we are making in the case of the Marine Corps. We're making with our decisions around what pesticides to use, many of which are nerve toxins. We should not be focusing on the individual. These are societal actions. Now, there's some things that individuals can do at the margins, and we give you 25 recommendations. But fundamentally, the health that individuals in the United States are enjoying or not enjoying are based on societal decisions that we've made.
No, I completely agree with the vital importance of taking responsibility to create a safe environment. What I was getting at, I guess, a little bit more is that once you have the diagnosis and that those exposures have been in your past, I've been reading lately about how hard it is, and I have had this experience myself, how hard it is for patients who already have a diagnosis to stick with, regimens that can help them cope with it. Not to blame them for it,
Yeah.
by any means, but it's it's a challenge, and a lot of what we're hearing from HHS these days is to deal with chronic diseases. Yes, change the food environment, change the toxic environment, of course. But then once that happens, you still have to watch what you eat. You have to exercise. And I'm just curious to know, are there any particular tricks you've come up with or systems you've come up with that really help people embrace these healthier lifestyles if they're already coping with a diagnosis that came from an exposure maybe decades before?
So at the individual level, I tell people I exercise not, well, I like to exercise, but I exercise primarily for my future self. And I think if you have Parkinson's disease, you have 15, 20 years if you're diagnosed at, say, 70 or 65. What do you want to look like 5 years from now? What do you want to do 10 years from now? Don't you want to be able to play with your kids and go to their soccer games and, travel on an airplane or whatever it is that you like to do? And the best way to do that is to exercise. And the other thing I tell people is if you're going to make me sweat as a physician, I'm going to make you sweat and make you exercise as well. So, I think there's lots of ways to get people to see things in a different light. But fundamentally, the reason why Parkinson's is one of the world's fastest growing, there are reasons why Parkinson's is one of the fastest growing brain diseases. There's reasons why 1 in 3 85-year-olds get Alzheimer's disease. There are reasons 1 in 31 children are getting autism. We should figure out why people are getting those. And I think for many people, it's because of chemicals in our food, water, and air. And no one has been at the front edge of leading this fight more than the Environmental Working Group and we need to make sure that we create an environment where people live long, healthy lives. I mean, we talked a little about the human cost, but there's huge economic costs. The economic burden of Parkinson's disease is $50 billion per year, half of which is Medicare. So Medicare spends $25 billion per year caring for people with Parkinson's disease. If we clean up our environment, we realize that in savings. We can reduce expenditures for Medicare. We can reduce expenditures for Medicaid. We can all live longer, healthier lives. and not to be devoting one out of every $5 of our economy to sick care.
No, I completely get that. Thank you. Those are great points. So let's talk just a little bit, and I wanted to touch on this in particular now. There seems to be a lot of pressure on funding in Washington that I just, can only imagine it occurred to Parkinson's researchers, Parkinson's treatment centers, and elsewhere that this is going to be maybe a challenging time. You write in your earlier book, Ending Parkinson's Disease. That's the first book, which I also strongly recommend, about a gap between the needs for Parkinson's research funding and what we're actually providing. What's the situation? How's it evolving right now when there's so much pressure in Washington to cut federal spending? What's your take on that, Ray?
Well, decisions have consequences. Decisions have consequences. And in the early days of HIV, there was no federal response to HIV, and people really died because of it. The people who lived with HIV, it was a matter of who lived until the time that AZT was first developed, and then when protease inhibitors were developed. And eventually a federal response was mounted. Today, NIH or last year funded $3 billion for HIV research. People like you and me may not have HIV today because of investments in HIV research. Today, HIV is preventable with a condom. Today, more people receive appropriate treatment for HIV than Parkinson's disease. Today, the incidence of HIV is its lowest level since 1990. Today, we can look toward a future that possibly sees HIV disappear as a major clinical entity. And that's because of activism, that's because of investment, and that's because of changing the status quo. HIV received, I said last year, $3 billion of research. There's about 1.2 million Americans with HIV. There's about 1.2 million Americans with Parkinson's disease. And last year, NIH spent $250 million on Parkinson's disease. That's just
Big gap.
big gap. And only 2 cents of every research dollar is spent on preventing the disease. There are homes in San Francisco where you are. There are homes in New York where I am that are sold for more money every day than we as a society invest in trying to prevent one of the world's fastest growing brain diseases.
Yeah.
If we don't change our course, more and more people are going to develop the disease. We're going to spend more and more money on Medicare caring for these individuals. Doctors are going to spend less and less time meeting the needs of people with it. We need to change the paradigm. We need to invest more in preventing Parkinson's disease. We need to invest more in finding better treatments to slow and possibly even cure the disease once we figure out its cause. Michael and I call for a 10x funding in the proportion of funding that goes to preventing disease. So from 2 pennies out of every dollar to 2 dimes, and a tenfold increase in the amount of funding that goes for Parkinson's research. And this is a bipartisan issue. I had the really good fortune last week to meet with Senator Shelley Moore Capito from West Virginia.
Yeah.
And she has a bill that would increase NIH funding for Parkinson's from around the $200 million range to the $600 million range. We've done this before in I think the last 9 years, funding for Alzheimer's disease has gone up 7-fold. And we now, for the first time, may have effective treatments, highly effective treatments, or at least moderately effective treatments for Alzheimer's disease. We need more evidence, but you're seeing a change in it. You see that the incidence of Alzheimer's disease is plateauing and maybe even decreasing depending on the studies you look at. We've seen a pathway for Alzheimer's. We've seen a pathway for HIV. We need to follow that same path and accelerate it, because the longer we take to do that, the more the people suffer. The faster we do it, the sooner we get rid of the disease. And we've seen this, polio, if you were born after 1955, you live in a world where polio is preventable. If you were born before then, your parents worry about you getting polio every summer. We
Yeah.
just need to come at this with a lot more urgency, because time is people's lives.
I could not agree more, and we'll certainly weigh in on Senator Capito's bill. We have a good relationship with her. She's one of the Republicans that we've gotten to know through the PFAS crisis, which of course first unfolded in West Virginia, in her home state. And she's always open to ideas that advance good science. So thank you for mentioning her legislation. Just one more question. Then I know you got to run. Wh- if you could name sort of one area of research, either on the cause end of things or treatment, that gets you excited these days about Parkinson's, is there something that comes to mind, Ray?
I don't think the answer. Research is important. What's really important is people making their voices heard. So, what changed the course of kids getting? So in 1980, the 13-year-old daughter of Candace Lightner was struck by a drunk driver and killed. She was literally knocked out of her shoes. 4 days later, Candace Lightner starts petitioning then Governor Jerry Brown of California every day for a year to change the laws. In 1980, drinking and driving is legal in some states. Eight
Yeah.
years later, drinking and driving is illegal in all 50 states. Drinking age is raised to 21. Blood alcohol level thresholds dropped to 0.08. Because of Candace Lightner, because of MAD, because of Mothers Against Drunk Driving, 10,000 fewer Americans, including possibly you and me and our friends, are not killed. That's 10,000 fewer children, 10,000 fewer schools, 10,000 fewer marriages, families, 10,000 communities not torn apart because of activism. We could say the same thing about polio. We could say the same thing about HIV. I think the Parkinson's community, I think Americans need to find their voice. I think for the first time, at least in my lifetime, there's an increasing awareness that chemicals in our food, water, and air are fueling the rise of chronic diseases, and Parkinson's disease is the poster child for it. I wasn't taught this in medical school, and my peers weren't taught this either. The sooner we realize that, the sooner we can take action and create a world where 80% of healthcare expenditures aren't on chronic diseases, where 40% of Americans do not have a chronic disease. We can create a world that's healthier, a world largely free of Parkinson's disease, I think largely free of ALS, where Alzheimer's disease is far less common, where far fewer children get autism, but we need to summon the will and our voices to make our voices heard so that we actually drive change to realizing these outcomes.
Well, you have an ally here at EWG and in me, Dr. Dorsey. It's a real honor to work by your side, and I hope we can help raise that awareness and get people literally out in the streets if we need to make sure that we focus on preventing this disease and getting it on the plateau, and then the downward slope is where we want to be. So thank you for this great book. It's The Parkinson's Plan: A New Path to Prevention and Treatment. Here it is, and I'm delighted to spend time with you again. Come back down to Washington. We'll hit Capitol Hill together, brother.
Outstanding. I'm delighted to be your disciple.
All right, man. Thank you. Yeah. Oh, where are they? Do I?
Supposed to send them to you. I'll send them to you. It's just a
Who sent them to me?
Alex should have Alex.
Okay, let's see. I am not seeing those. Ray, I'm looking for these questions. Did
I just sent you a
okay. Okay. Oh, okay. Ray, do you have a few more minutes?
I got time for you anytime, Ken.
Okay, all right. So these are sort of rapid response things pertaining to paraquat in particular. So the first one is, if you had like 20, 30 seconds to explain to someone what the hell paraquat is, how would you describe it?
So paraquat is a weed killer first developed in the 1960s. It kills the weeds that Roundup doesn't. It's sprayed on corn, cotton, soybean, and vineyards. It's associated with 150% increased risk of Parkinson's disease, and the laboratory reproduces the features of it. Over 50 countries, including China, has not. The EPA says one sip can kill, but paraquat is sprayed in increasing amounts on these fields every day throughout the United States. And along with it, I think, are the seeds of future cases of Parkinson's disease. If we ban paraquat, which we're long overdue to do, we send a clear message to the Parkinson's community that we're serious about preventing Parkinson's disease, and we spare future generations this terrible disease.
Well, you've answered all of the questions on this list, and I'll only add that EWG is working hard to try and ban paraquat in California and Pennsylvania. We've also have an initiative there, and frankly, we would love to see action taken by EPA in Washington. It seems like the agency is going in the opposite direction on a lot of pesticide decisions these days, unfortunately. So that's not going to make America healthy again anytime soon. And unfortunately, paraquat is high on our list for action by state and federal agencies. So here's hoping that we'll join the other 70 or so countries that have banned paraquat soon.
And there's a great op-ed by Nick Kristof from the New York Times, the front page of the opinion page this past weekend in New York Times. Senator Capito, actually, when we met with her, actually referenced the article and said that she was going to take a deeper look into this. You know, the pesticides from the 1960s, few of us would fly in an airplane or drive a car from the 1960s because engineers can come up with safer alternatives. If engineers can come up with safer cars and safer planes, chemists can certainly come up with safer weed killers.
Yeah, absolutely. It's time we did that. A lot of the chemicals used in modern agriculture date from Sputnik. So it's time. It's time to update. Ray Dorsey, thank you so much for your time, and thank you even more for the energy you devote to advocacy and making a difference for so many people who are facing a diagnosis of Parkinson's, but also the generations to come. Let's hope we can spare millions of Americans this disease.
Yeah, we're not hoping. We're going to do this. And Michael and I are coming around the country. We have a listening tour. So if your listeners can go to pdplan.org. I'm visiting 25 cities this year. Michael's visiting a similar number. We put out a plan in the book to plan. We said, I think we quote Eleanor Roosevelt. I quote Eleanor Roosevelt at the beginning of the book. Let me see what she said. She said, yeah, here it is. I got to get my glasses on. She says it takes as much energy to wish as it does to plan. So we give you a plan for individuals, plan for communities, getting rid of pesticides in your kids' schools and playgrounds, and a plan for us as a society to create a world largely free of Parkinson's disease.
Amen, brother. And as a political consultant friend of mine used to say all the time, if it ain't written down, it ain't a plan. And you've written it down, and you've written it down in the Parkinson's Plan, A New Path to Prevention and Treatment. Ray Dorsey, Michael Okun, your co-author. Thanks so much, brother, for all that you do.
My pleasure, Ken.
Thanks.